We are so excited about our Coastal Expert segment today because he's a familiar face, but with a new name. And with that new name at the practice, well, a lot of great things going on that we're going to talk about today. And joining me right now is Dr. Shanklin with Coastal Empire Plastic Surgery, but not anymore Coastal Empire Plastic Surgery because the name has changed to Renewal MD. So tell us about the reason for the change.
That's correct, Natalie. We as a group decided really about 12 months ago that we were going to transition and really take the next step for our patients to provide more than just plastic surgery. We're going to provide an integrated, more holistic approach to helping them achieve what they want to have long term. It's not just surgery to give them that outcome, but it's much more involved than just surgery. It's their nutrition, it's optimizing them for when they did have their surgery. It's optimizing them for the post-operative and recovery period. And then certainly it's for our patients that do not want surgery. And there's a large number of patients out there that would always say, yes, I'd love to have something done. I just don't want to have to go through surgery to have it done. And we, when we really started the practice about 18 years ago, transitioned into a lot of non-surgical type of options, and we've really integrated that further to provide for our patients, and integrated for some where it's both surgical and non-surgical treatment options to give them an ideal outcome.
Talk to me about some of the new things that patients can look forward to, new services, new products.
Well, in terms of products, we have decided to branch out and create our own skincare line that's specific Renewal MD skincare. We've used several different types of products in the past, and we feel like we've taken some of the best practices from several different product lines and combined that into our own to create for patients what may be a minimal number of steps and something that for them they may have had experience with other products, and we're trying to combine products to where it may be one step instead of two or three for them. And biggest reason overall is to help them improve their skin health. And it's not, as I said, it's an integrative approach, so it's not just what they're putting on the outside, it's what they're taking in and other things that they're doing overall that improves their health.
So just a way to really renew a person is what you're talking about, the whole person in general. You and your partners, Dr. Megan McGovern and Dr. Michael Huntley, have a pretty solid reputation, of course, in the aesthetic cosmetic procedure world. So how will this new approach enhance your ability to treat the whole person? Because every individual is different.
Absolutely right. And the biggest part is any patient that comes in, it's not just walk in and, oh, I want this cosmetic procedure. Part of that, even before we made this change, was assessing whether that patient is a good candidate. And that's a good candidate from their own health, but also a good candidate from just their physiologic health, but also their psychologic health, as to whether or not what they were trying to achieve could be achieved, or whether they had unrealistic expectations. Big part of what we've moved into is more of looking at them also nutritionally, because that's going to benefit how they respond by improving them before surgery, so they'll have a better outcome during surgery and after surgery. They'll heal faster, they'll be able to get back up on their feet faster, and overall they should get a much better outcome. And then the other regimens that we're going to be doing is to then maintain that effect for them for long term, rather than just the kind of cookie cutter of, oh, we'll come back in 8 to 10 years and we'll do this other procedure, or we'll just repeat that procedure again to get that same result back. Our goal is to provide for them a long-lasting effect, and using the different modalities that we're going to have as part of the practice to maintain that effect.
So the services are not going away by any change. We're talking about a name change with new and improved services and products to look forward to. What about people who they're a little afraid of cosmetic surgery. They don't want to do any type of surgery. They're afraid of the non-invasive things like Botox, but they still want to age well. Is there something that you guys could offer them at Renewal MD?
Well, certainly with the newer skincare line, as well as some the non-surgical treatments that our estheticians provide that can give them improvement in areas from the standpoint of facial rejuvenation, also the treatments that we provide of non-surgical fat reduction. We have the device called Sculpture, which is an external device that essentially helps to remove fat. And patients are still evaluated by each physician or by a physician in the group to see whether they're a candidate for that device. And that allows them essentially to walk in, lay down, and the treatment regimen for the Sculpture is going to take less than an hour for each treatment, and they get up and walk out.
So if you want to look and feel your best, you definitely want to pick up the phone or call or check out their website, Renewal MD. Thank you so much, Dr. Shanklin, for joining us. It's always great to see you.
Thank you, Natalie. It's always a pleasure.
If you'd like more information on Renewal MD or any of our coastal experts, just check out our Coastal Experts page. That's at WSAV.com.